Hi, I'm Lauren Hagen, and I'm the manager of Natural Beginning at OB-GYN North. I wanted to take some time today to give you a little bit of information about what to expect as a new pregnant patient of ours. One of the first things I want to make sure that all of our patients are aware of is that we are a collaborative practice. What that means is that we have midwives and we have doctors who collaborate to take care of you. Each one of those providers will be taking care of you throughout the course of your pregnancy. So from visit to visit to visit, you'll be meeting each one of them. We encourage you to choose a lead provider somewhere in the course of your pregnancy. After you've met a few of them, if there is a provider that you feel you connect with really well, we ask that you let us know, and every other visit will be with that provider, and we call them your lead provider. That's different than a lot of OB-GYNs manage their practice, and so we want to make sure you know that before you start your course of care with us. The other thing that I want to make sure everyone is aware of is what a midwife is. All of our midwives at OB-GYN North are certified nurse midwives. So that means that they are registered nurses with master's degrees, and they have years of education and training on top of that. So they're well prepared to treat women through the course of their pregnancy. One of the most important things for you to know is our phone number. We want you to call that number regardless of what time of day it is or what day of the week. If it is an after hours call, then the call will go to an answering service who will page the doctor or midwife who's on call, and they will call you back in 15 minutes. If you don't get a call back, it means they're probably delivering a baby, so just try again and they will call you back. If it's a true emergency and you can't wait for that call back, that means you should go on into the hospital. Another way to contact us is through the patient portal. If you haven't already, then there will be a way for you to set up your portal through your email. That is a safe way for you to send us questions, but we ask that if you send us questions through the portal, that those not be potentially urgent medical questions. So for example, if you're having some bleeding or you're concerned you're having some pain, please don't send that through the portal. Better questions for the portal are things, for example, like there's this herbal tea I love to drink, is that safe in pregnancy? And just between the time you ask the question and you get the answer, just don't drink the tea until you get the answer. But we ask that you give us about a 3-day turnaround on the portal messages. And if ever in doubt, just give us a call. That's what we're here for. Another important thing we want you to know about is the general pregnancy calendar. This is fluid, so there's not an exact timing that your visits need to be. It's okay if they are a little bit earlier or a little bit later than what I'm describing. So first, let's start with your due date. So it's important to know that the due date is a midpoint on a curve. So your due date is set at what would be 40 weeks. But it's very normal for people to deliver their babies anywhere between 38 weeks and 42 weeks. That's really a due month. It's 4 weeks long. If you can start thinking of that in your mind as a month-long time frame that would be normal for you to have your baby, rather than thinking of yourself as a library book that's late the day after the due date. We don't consider you late unless you're more in that late 41 to 42 week range. We're counting from your last period when we're talking about the weeks. So we start on day 1 is the first day of your last period. So the first visit that's usually on the pregnancy schedule is the 8-week visit, and that's where we draw a panel of blood that tests for rubella immunity and your blood type and an STD panel. An ultrasound is usually done at this visit. So earlier we do an ultrasound around 8 weeks and we can actually see the baby. That's the most accurate ultrasound for dating purposes. That's how we know if your period lines up with how far along your pregnancy actually is, because sometimes there's a discrepancy. So we do like to do an ultrasound at 8 weeks. We don't do very many ultrasounds here at this practice because they're only medically necessary at certain points and for certain reasons. So it's important to know kind of the reasons why we would. The next visit is the 12 to 13 week visit, and that's where we do genetic testing. There are different ways you can do genetic testing. 2 of them are blood tests, so it's a simple blood draw. One of those blood draws will screen the mother's DNA, your DNA, to see if you are a carrier of a recessive trait for a condition. You wouldn't know that you have that because it's recessive. So that would mean you have a recessive gene and a dominant gene, and you express the dominant gene. But if you have a recessive gene, and your partner also has that same recessive gene for a disorder, then it's possible for you to pass that disorder on to your baby. So we can screen you for any of those recessive conditions. And the next step, if you did test positive for any one of those genes, would just simply to be have your partner do a blood test, and we'll check the same thing for him. We can do that at any point in your pregnancy. We can even do that before you're pregnant because we're just checking your DNA. The other test that probably most people are more familiar with is a screen where we check for fragments of the baby's DNA in your blood, and they can see if your baby has any of the trisomies. There's trisomy 13, 18, and 21. Trisomy 21 is also known as Down syndrome. That's the test a lot of people are more familiar with. Because we're looking at baby's DNA, we can also see if you're having a boy or girl at that point. So when you go to schedule your 12-week appointment, if you're not quite sure if you want to do genetic screening yet or not, go ahead and tell us you do want to do it so that we can put you on the schedule, because it's easier for us to take you off than add you on at the last minute. We want to make sure you're aware of one of the other differences in our practice, which is that if you are having a little boy and you do decide to circumcise, we perform circumcisions here in the office rather than at the hospital. So that's something that is different. We want to make sure you're aware of before you're in the hospital. And circumcisions are done here between 14 days and 30 days of life to establish a good breastfeeding pattern between you and your baby prior to introducing a surgery for your baby. So be aware of that. We can get that scheduled once your baby's been born if you do choose to have a circumcision. The next visit is around 14, 16 weeks, and that's where we can start hearing your baby's heartbeat with a Doppler. So just the handheld Doppler, we can hear the baby's heartbeat with that. So it's not necessary to do an ultrasound, but we can check on baby's heart rate that way, and it's easy and a little less invasive. The next visit is your 20-week visit, and that's where we do an anatomy scan. So we check baby's anatomy from head to toe to check for normal development, including baby's organs, and we measure baby. So baby's femur bone is one of the measurements that they take to see if your baby looks like they're a little smaller or a little larger than average. At 24 weeks, we want to make sure that you, by this point in your pregnancy at 24 weeks, have thought about childbirth education classes, because it's very useful to have the information that's relayed in those classes, because if you've never had a baby before, then it can be anxiety provoking if you don't know what to expect. So we do require each of our patients to take some form of childbirth classes, but it doesn't have to be any specific kind. That's up to you. Whatever ones you can find that are available online. You can do birthing from within, Bradley, hypnobirthing, any variety. It's up to you. So take a look at your options. So the next visit that is typically scheduled is the 28-week visit, and that's where we usually screen for gestational diabetes. That's an important screen because it's a pretty common occurrence for women to test positive for gestational diabetes. The good news is there's a lot that we can do about it to help baby be healthy, very simply. Most of it is usually just diet adjustment and exercise. Sometimes you might need a medication if you test positive for gestational diabetes, but that usually controls it really well, and baby can be born at a normal weight and with normal organ function, and everything is good. There are two ways to screen for gestational diabetes. One option is to do the glucose tolerance test, and that's where we have you fast from the night you go to bed. You wake up and don't eat or drink anything. So we'll usually schedule you to do this test in the morning so that you can eat soon after. And you come in and they draw your blood for a fasting glucose test, and then they have you drink a Glucola drink. The Glucola drink is a 75-gram load of sugar, so it's a very sugary drink. It's like a sugar water, essentially, which might not be pleasant and might upset your stomach a little bit. But what we want to test is to see how your body handles that particular exact load of glucose. If you have gestational diabetes, then your blood sugar will be high at one of the three checks that is done. One is the fasting check prior to drinking the drink. The other is 1 hour after you finish the drink, and the third is 2 hours after you finish the drink. So during that weaning period, you'll usually see a physician or a midwife somewhere in there and have your visit done, all the stuff where they measure and check your blood pressure and listen to baby's heart rate. While you're waiting for the blood draws, we ask that you not be very active, so don't go on a walk, but also not take a nap. We want your metabolism to be kind of at a normal, kind of mid-range, so we'd like you to sit awake but still and read a book, watch a movie, do something like that. And we ask that you not leave the testing site when you're having that done. The other option, if that doesn't sound appealing, is to use a glucometer that you can get at a pharmacy. and check your blood sugar through finger sticks that you do 4 times a day for 7 days. The first one is a fasting check before you've had anything to eat or drink. And then the other 3 are taken at 2 hours after breakfast, lunch, and dinner. So it's 2 hours from the time you start eating. That a little bit more time consuming, but then you can avoid drinking that glucola drink. So you get to pick kind of which one sounds better to you. After the 28-week visit, you may have noticed that each of these visits have been about 4 weeks apart. So after that point, we start to see you, that's where you begin your 3rd trimester. And so we start to see you a little bit more frequently. From that point, it's every 2 or 3 weeks rather than every 4. Once you get to the 36-week visit, the big thing to know that we do at that visit is we'll screen you for group beta strep. We also call that GBS sometimes. What that is a bacteria that lives in many people's GI system, and it's normal. It should be there, or it's not problematic for it to be there, and it's there. It can kind of come and go. It doesn't cause us any kind of infection. But when babies are born through the birth canal and they're exposed to GBS, most of them do fine with that and don't have a problem. But some of them get very, very sick. And we want to, because we know that we can avoid that if we test a mother for GBS, give her antibiotics while she's in labor. So we'll give IV antibiotics, and that's usually dosed about every 4 hours. So we want to make sure you have a dose of the antibiotic in 4 hours prior to delivery. So depending on how long your labor is, you'll get doses of IV antibiotics through your labor. So from the point of your 36-week visit, we start to see you every 2 weeks. So then there's a 38-week, a 40-week, and then we go to 1 week. So from 40 weeks, we might see you twice between your 40 and 41-week visit, and then definitely twice between 41 and 42 weeks if you are still pregnant. If you get to 42 weeks of pregnancy, then we will be talking to you about induction. We want to do that no later than 42 weeks and 0 days of pregnancy. So we'll actually talk to you about that prior to that date. So if your doctor or midwife mentions or suggests getting you scheduled for an induction around the time that you're 39 weeks when you have the conversation, it's not because they think that you should have had your baby by now. It's that in case you are still pregnant at 42 weeks, we want you to have time to plan and prepare for what that date would be. So just to reduce anxiety about being asked about induction around 39 weeks, we're not wanting to induce you then. We're wanting to make sure there's something on the books for you if you need it later. At our practice at OBGYN North, we prefer not to induce labor. We want your body to start labor on its own, because we know from research that labor usually progresses pretty well and more efficiently when your body starts labor on its own. However, there are really good reasons to induce in some cases. If that comes up and is a discussion with your provider, please know that it is a very common and normal thing to do. But in the absence of a medical reason to do so, we usually will encourage you to go into labor on your own.